Stool softeners vs. fiber supplements. Which one's right for you? You're standing in the pharmacy aisle staring at bottles and boxes with laxative labels. Maybe you have constipation and are wondering what's the best solution. Maybe you have IBS and are trying to find a way to help with the hard, lumpy stools. Or maybe you're curious about the differences because you've seen stool softeners prescribed for hemorrhoids and fiber recommended for gut health. Well, whatever the reason, you're not alone. Millions of people use stool softeners and fiber supplements regularly. But do you really know how they work, when to use them, and which one might be right for you? Today, we'll break down the science, the benefits, the risks, and the secrets your gut wishes you knew. We hope you learn something new and valuable so you can make informed decisions about your gut health. Coming up next, hi, I'm a doctor, and let's start by understanding the problem. In today's world, lots of things can slow our stool down as it travels through our colon. A low-fiber diet can make the stool hard and small. Not drinking enough water keeps the stool from getting soft and bulky. Stress and lack of exercise can also slow it down. And certain medications like painkillers, antidepressants, and even iron supplements can cause constipation. In fact, up to 20% of adults experience chronic constipation at some point in their lives. So what can we do about it? Two common solutions often line the pharmacy shelf: stool softeners and fiber supplements. Let's dive into them first. What are stool softeners? Stool softeners are a group of drugs that come in liquid or capsule form. They work by adding water to your stool, literally softening it and making it easier to pass. When you swallow them, they dissolve in your stomach or intestines and then mix with the contents of your gut. This softens the stool and helps it move along. The most common type of stool softener is docusate sodium. It's available under brand names like Kalachi and Peri-Kalachi. Docusate works by changing the properties of the stool and adding water to it. It's great for providing fast and gentle relief, and it's particularly useful after surgery or childbirth. In these situations, straining to have a bowel movement can be dangerous. That's why stool softeners are often recommended by doctors, as they reduce the need for straining. However, it's important to remember that stool softeners don't fix the underlying cause of constipation, such as a low-fiber diet or lifestyle factors. Instead, they simply make passing the stool easier. While this can be helpful in some situations, it's essential to understand their limitations. Using stool softeners long-term won't address the root causes of the problem, which means the constipation might return when you stop taking them. Plus, there are potential risks to consider. For example, some studies suggest that long-term use of docusate may lead to an increased risk of vaginal cancer in women. That's something you should discuss with your healthcare provider. Overall, stool softeners can be a good option for short-term, occasional use. But if you're dealing with more chronic constipation, it's worth exploring other options like fiber supplements and making changes to your diet and lifestyle. Next, let's talk about fiber supplements. Fiber supplements are products that contain plant-based compounds that are typically classified as either soluble or insoluble. Soluble fiber is found in foods like chia seeds, avocados, basil seeds, psyllium husk, and fruits like apples and oranges. Insoluble fiber comes from sources like wheat bran and vegetables like carrots and broccoli. Soluble fiber absorbs water and expands in the stomach, forming a gel-like substance. This can help soften the stool and make it easier to pass. Insoluble fiber doesn't dissolve in water, but it adds bulk to the stool, helping to regulate your bowel rhythm. Both types of fiber can be beneficial for overall gut health, in addition to potentially alleviating constipation. Fiber supplements play a crucial role in feeding the trillions of bacteria that make their home in your gut, commonly referred to as your gut microbiome. These bacteria rely on fiber as a food source, and when fed, they produce substances known as short-chain fatty acids. These short-chain fatty acids offer numerous benefits, including reducing inflammation in the gut, enhancing the gut barrier function, and even supporting the body's immune system. Some research has shown that increasing fiber intake through supplements can help reduce the risk of developing certain conditions like diverticulitis, hemorrhoids, and even colon cancer. Now, let's compare them side by side. We hope this chart makes it easy for you to see the key differences. In summary, stool softeners are effective for quick relief, particularly after surgery or childbirth, while fiber supplements are better for long-term gut health. Now let's delve deeper into each supplement's benefits and drawbacks. Stool softeners are generally well tolerated and considered safe for most people when used occasionally. However, it's important to follow the recommended dosage. Taking too much can lead to problems like nausea, abdominal pain, and diarrhea. Additionally, as mentioned earlier, long-term use of stool softeners, especially docusate, may increase the risk of certain complications. On the other hand, fiber supplements are generally safe and well tolerated. However, there are a few things to keep in mind. First, they work more slowly than stool softeners. It may take several days or even weeks to see results. Second, fiber supplements are most effective when combined with adequate hydration. Not drinking enough water could potentially lead to bloating, discomfort, and even worsened constipation. Third, some individuals, especially those with IBS or other sensitive guts, may experience bloating or gas when starting to take fiber supplements. To avoid this, it's a good idea to introduce fiber gradually into your diet and increase your water intake. Lastly, it's worth noting that there are different types of fiber, soluble and insoluble. Soluble fiber can help soften the stool and is often the primary component of over-the-counter fiber supplements. Insoluble fiber doesn't dissolve in water and mainly adds bulk to the stool. While both types are essential for overall gut health, if your main concern is softening the stool, soluble fiber is likely to be more effective. So which one should you choose? If you're looking for quick relief, especially after surgery or during pregnancy, stool softeners might be a good choice. But if you want a more natural and long-term solution for constipation, fiber supplements are likely the better option. Here's a simple trick. Try increasing your fiber intake and drinking plenty of water first. And if that doesn't work, then consider adding a stool softener as recommended by your doctor. Beyond supplements, there are two other important things to consider. First are the natural alternatives. Foods high in fiber, like kiwi, prunes, oats, and beans can work wonders. Kiwis are not only high in fiber, they also contain enzymes that help break down food and make it easier to digest. Prunes are rich in fiber and sorbitol, a sugar alcohol that adds bulk to the stool and helps soften it. Oats are a great source of insoluble fiber, which helps regulate bowel movements. Beans are packed with both soluble and insoluble fiber, making them an excellent choice for improving digestion. Beyond fiber, staying hydrated and incorporating regular exercise into your routine can significantly impact your bowel movement. Finally, establishing a regular bathroom routine can be immensely beneficial for those with constipation. Make it a habit to sit on the toilet at the same time every day, ideally after a meal. Your body will get the hint, and it'll make things happen. Second are the additional benefits that both these options provide. Both stool softeners and fiber supplements can indirectly benefit heart health by aiding in digestion and potentially lowering cholesterol levels. Fiber supplements, especially those containing soluble fiber like psyllium husk, have been shown to reduce total and LDL cholesterol levels. Stool softeners, by easing constipation and promoting regular bowel movements, can indirectly contribute to better heart health. Additionally, fiber supplements can help manage blood sugar levels, making them beneficial for individuals with diabetes or those looking to improve their metabolic health. A meta-analysis published in the American Journal of Clinical Nutrition found that increasing dietary fiber intake can significantly reduce fasting blood glucose levels. It's important to note that the supplements discussed in this video are intended to complement a healthy diet and lifestyle. They are not a substitute for medical treatment or advice. Before starting any new supplement, especially if you have underlying health conditions or are taking medications, consult with your doctor or a healthcare professional. Before we wrap up, let's hear from you. Have you tried stool softeners or fiber supplements? What was your experience? Leave your thoughts and questions in the comments below. And don't forget to subscribe for more science-backed health breakdowns that actually make sense. Until next time, stay strong and healthy.